before. I think true beauty comes from within. People could look amazing and beautiful on the outside, but if they don't have a genuine heart, then they could be ugly.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Susie Reese of Timeless Aesthetics. She's been an RN for 40 years, with the first 20 years spent in the mental health field because she was drawn to people's feelings and wanted to help in that capacity. She then got into aesthetics because she needed a change of pace and always loved beauty. She started out working with a plastic surgeon's practice and quickly refined and honed her own skills to help men and women look and feel better about themselves. She grew her practice a few years ago and now is located in a beautiful 3,000 square foot office designed to look and feel timeless. The practice was recognized as Best Med Spa in Colorado Springs for 5 years in a row, with last year taking gold. So Susie, welcome and glad to have you here.
Thank you so much. It's good to be here.
Yes, I'm curious, how did you first get interested in medicine? Let's start there.
Good question. Long time ago. I think I went to college freshman year, and I was wondering what I would be good at, what comes natural for me. And I've always been good at taking care of people. So that's how.
Okay. And then in your introduction, you made that transition over to aesthetics because you needed that change of pace. You also love beauty. But was there something about aesthetics that really drew you into it? Like, what was that transition like going from mental health to aesthetics? I don't know if that's typically a normal path people take from mental health to aesthetics, but what was that like for you making that transition?
Well, I think they both fields have the same component, and that's taking care of the heart. And true beauty comes from within, and that's my motto. I try to bring that out in clients now. Um, but I've always loved beauty, as you said,
Mhm.
and I was watching a show back in the early 2000s. Oh gosh, now I'm blanking on it. It was about aesthetics, and I was so drawn to that scene. And so I thought I need to get myself trained. I volunteered at a plastic surgeon's office on my days off to learn for 6 months. And so I went in on my days off and learned the skills to eventually become employed by their med spa.
Okay.
So I worked there for 6 years, and then for another facility for another year, and then decided to go out on my own.
Okay. So what was it that I guess what was that catalyst for you wanting to go out on your own? I mean, why not just keep working for another med spa?
Well, I was making them a lot of money. And I thought, well, might as well make myself that money. So,
There you go.
yeah,
Okay.
yes.
Now that you have this practice, what are some of the most common treatments that your patients, your clients come to you for?
Botox, Dysport, Newtox, those are the neuromodulators. They're great for wrinkles. We do lots of injections, such as fillers. We specialize in regenerative medicine, so we like to do a lot of biostimulator fillers, such as Belafil and Sculptra. They last longer um, by stimulating your own collagen. And we also have lasers like the Morpheus, even though that's not a true laser, but it does skin tightening. It can also reduce unwanted fat in the submental area. and the jawline. Um, we do body treatments such as the Evolve, which is our body contouring machine. Um, we also specialize in weight loss programs, um, using the GLPs, and probably will expand into peptides, which are good for you health-wise.
Okay. Now, I know that from introduction that you're a trainer for Belafil. You mentioned that that was one of the biomodulators. Did I get that one correct?
Biostimulators.
Biostimulators. Okay.
Yes.
All the bio ones getting me confused. So biostimulators. So what is Belafil? I've heard the name, but could you explain a little bit more about what is Belafil?
Sure. It's made up of PMMA and and cows, bovine collagen.
Mhm.
And so the reason why it lasts 5+ years is because of the PMMA, polymethyl methacrylate, and that is a substance that has been used in medical devices for years, like 70+ years.
Hmm.
So it's a safe filler. In fact, it's the safest filler out there. There's um, the adverse effects are very minimal compared to the other hyaluronic acid fillers. Um, so what makes it really good is that you'll get an immediate result because of the bovine collagen.
Mhm.
And um, because bovine doesn't last more than 3 to 4 months, as that degrades, your own collagen starts to form. And
Okay.
the
So
PMMA.
so it starts working kind of in combination, the bovine with your own. So I guess you're getting kind of the best of both worlds in that sense.
Correct.
Okay,
Yes.
got it. So what is it used specifically for? Is it for uh like trying to make the skin look younger? Is it for reducing wrinkles? Is it for kind of plumping up? Like what's the main thing that it does?
All of the above, but
Hmm.
mostly we use it for volume depletion. So people that are a perfect example are people that have been on GLPs, losing the weight, and they lose so much fat in their face. So they end up looking older and more gaunt.
Mhm.
So we can replace that with Belafil. Yeah.
Okay, got it. So Belafil is kind of like a filler, but
It
not
is.
okay. Is it like a
Yeah,
filler or is it a filler?
it is a filler,
Got
but
it.
we refer to it as a biostimulator
Mhm.
because it's not like a typical hyaluronic acid filler,
Mhm.
such as Juvederm and Restylane,
Mhm.
because those are temporary and they don't stimulate collagen, um, whereas Sculptra and Belafil do.
Okay. So if you get Belafil, how long does it typically last for?
Up to 5 years,
Oh
the
wow.
is FDA approved.
Hmm.
But they're doing a study now where it's lasting longer than 5 years.
Wow. Okay. So when you get this, then it could really fill you out, fill your face out, and it's gonna last for a long time, 5 years or so.
Yes.
Okay. And so how many treatments does someone typically need to get for this? Is it just like a one and done kind of thing, or is it being to multiple treatments? Like, what does that look like?
Very good question. Um, we typically say that nothing is one and done.
Mm,
Um, so we like to start with like a kit of Belafil, which is 5 syringes. And I know that sounds like a lot, but it's not. Even though so each syringe equals a quarter of a teaspoon, and that's with all fillers,
mhm.
even Restylane and Juvederm fillers. Um, so it's not a whole lot of product that's going in your face.
Mm,
So we start with the kit that's like the foundation, and then we can go from there and
mm.
see how much more they need.
Okay. So for that kit, those five syringes, is that all being done in one session or is that split out over multiple sessions?
It's typically done in one
Okay.
session
Okay. So then you get the one session done, and then how quickly do you see the results? Did you start seeing it right away, or is it a couple of days, couple of weeks? What does that look like?
immediately,
Oh, wow. Okay.
immediately because of the bovine collagen.
Okay.
Yeah.
So then you start getting it, you start seeing how they're starting to fill out, and then from there, if they need more, do you just do more at that time when you see do they need it or not, or do you need to give it some period of time first before they can come back for additional sessions?
No, we typically let them know that they need more.
Okay. Okay.
Yes.
So you can do it right then and there.
Yes.
Okay, that's nice then. I guess they just come in one time and then really get a feel for is this working? And then if they need more, they can just get it right then. They don't have to keep coming back over and over again.
Correct.
Okay, wow. So that's pretty incredible. I mean, you get it done once and then from there it's going to last you for several years. So it's pretty incredible.
Yes. Clients love it.
Okay. So it's Belafil. Now, you mentioned also regenerative medicine. So I want to dive a little bit deeper into this because I'm starting to see more and more practices bringing this in. So just for people who don't know what regenerative medicine is, could you give just a simple overview of what is regenerative medicine?
Sure. Um, typically, it's stimulating collagen, your own tissue. So when you do that, it's going to last longer. People are getting filler fatigue through the shorter term fillers, such as the hyaluronic fillers, because they typically last 6 months to a year. And people are kind of tired of getting, that done every 6 months or a year. So as they learn about biostimulation fillers, they're, more and more people are moving towards that.
Okay. So regenerative medicine is really about using your own body's, I guess I call it materials to help regenerate the body. That's
Tissue, yeah.
regenerative medicine. Okay, got it.
Mhm.
So when it comes to regenerative medicine, I think some people may have heard of things like PRP or PRF and things like that. So that's basically what regenerative medicine is kind of taking. And I guess my understanding is that you take the blood out and then you spin it in most situations and then put it back in. Is that, would you say, a correct
Yeah.
assessment of what it is?
Yes.
Okay. And could you explain a
Yeah.
little bit about what is the science behind that? Because I mean, just from as a layperson, I think, okay, you're drawing my blood out, you spin it, and then you put it back in. So like, I'm assuming something is happening in the spinning process, but like what? Because it's like it's still blood, right? You just spin it. So could you explain a little bit about what goes into that spinning process?
It's my understanding that it's plasma that that is stimulating collagen. So the basis of regenerative medicine is really to stimulate collagen, your own.
Mm,
We don't do PRP or P or PRF
mhm.
um, because we use other things such as Belafil that can do,
Mm,
I think, in my opinion,
mhm,
better,
mm.
better things.
Okay.
So,
So I like to dive deeper into that one because, from my understanding of it, is that you really have two options when it comes to regenerative medicine. You're either using some kind of animal derived product like the bovine one you mentioned, or you're using your own blood. So, in what situations would the animal derived products be a better fit than your own blood?
it's kind of hard to compare because we have not done PRP or PRF
Hmm.
using your own blood. Um, what I've heard is that your own stem cells may not be adequate enough to produce collagen.
Hmm.
So that is my understanding.
Okay, so maybe if you're a little bit older, your blood may be, I don't want to say low quality, but I mean, I can't think of another word. Like if you're a little bit older, maybe your blood is not as doesn't have as much potency or not able to help you regenerate as well. So in that case, then the bovine related products is probably going to be a better fit for you.
Correct.
Okay.
And again, bovine doesn't last more than 4 months,
Hmm.
but it's the PMMA in the Belafil that helps stimulate your own collagen.
Okay. Okay. Got it. So I also want to understand a little bit more when it comes to your practice. I believe that the strength of a team is really important to building a successful practice. So could you talk a little bit more about your team and really kind of how your team has helped you within the practice?
I have an amazing team, and I'm very particular about who I bring on. For that reason, I just want to protect um, our culture. And when I say that, I, I select people that are like-minded, like me, that find it important to deliver the best service to our clients as possible, whether that's, being really friendly. Um, the skill level is highly important. They train with me, and then they're pretty much on their own. We do have a medical director over that oversees us. That's how I'm able to practice the way that I do in Colorado. Um, but everybody on my team has the same um, desire to do that for our clients.
I see. And when it comes to educating your clients, what's your process for yourself and also that you've taught your team? What's your process for educating the clients really on the benefits? Because I'm sure you get a lot of people coming in, they think they want something, but they really need something else, or they have these wrong misconceptions about what is right and what's wrong.
Yes.
So what's your approach and how do you teach your team how to educate your clients?
That is a very good question. Um, because we often do see clients coming in with, well, I want Botox. Well, why?
Mm,
So we always ask, what bothers you? And so then we explain about the aging face, that it's tissue from the bone out that gets diminished over time, or can change over time. And we assess their face and we look at, okay, well, what's really going on? What's the source? We don't just treat the symptom. Lots of times back in the day, people would inject the nasolabial folds and the marionette lines
mm,
because people look at themselves two-dimensionally. We see them three-dimensionally, and we tell them that. And so we educate about the aging face, the two-dimension versus three-dimension, what they need, what those products will do for their face, and go from there.
okay. And what are some of those common misconceptions or common myths that you hear most often from your clients?
That's a really good question. They think that Botox is the answer for everything. It's not.
Mhm.
It helps with wrinkles because it temporarily immobilizes the muscle. So it only works on the muscle. And I always tell my clients that no matter what they do, if they do lasers, skin tightening, resurfacing, whatever, they're still going to need to do Dysport or Botox or Newtox
Mm,
to temporarily immobilize the muscle
okay.
if they don't want those fine lines.
Okay. So let's say someone is looking to for a provider that's they're looking for someone who's good, who's experienced, who can really help them out. What would be the most important piece of advice you would give to someone like that who's looking to get some type of treatment done, but doesn't know who to go to?
We often, well, we ask every client, how'd you hear about us?
Mm,
And the most common answer is, well, we saw your Google reviews.
mm,
Then we dive deeper and looked at your website, and saw that you're number one. So I think reputation is a big deal.
mm. Yeah, no, I think that's how most people will look at businesses would be the reputation side. And I think reputation has a big part to play as far as it gives people the perception of how long you've been around for, how knowledgeable are you. So if you have a lot of good reviews, people are going to view you as that expert. If you don't have many reviews, they're going to view you as not the expert. So I guess that's a good place for people to start, right? Look at the online reviews of whichever provider you're considering and then go from there, right?
Correct.
Okay.
Correct.
Are there any red flags that people should keep an eye out for, like when they're trying to figure out who's that provider and who's not? Yeah, are there any red flags that you would advise them to keep an eye out for?
I hate to say this because I have so much respect for estheticians,
Mm,
but they shouldn't be doing injections. They're
mm,
not medically trained
mm-hmm,
like nurses are.
mm-hmm,
Um, but they're awesome with skincare.
mm,
So I that would be a red flag to me.
okay.
Some estheticians are able to perform injections in a certain setting, and it depends on their state and what their regulations say.
Mm,
Um, but that would be a red flag for me.
mm-hmm,
Also, somebody that is price, looking for the best price, that's not always
mm,
the best way to go or get something done to your
mm-hmm.
face.
Okay, so price, if it's too good to be true, it probably is too good to be true. So you gotta be careful about that. Okay.
I often get, yes, I often get people that have gone to other injectors that were cheaper
Mm-hmm.
and they come to me to correct what they did.
That's a really good point. I think most people miss that part of it is that they think, oh, this person's cheaper, I'm gonna go to them. But then they pay for that, they do a bad job, then they have to go to someone else, pay to get it
Yeah,
undone, and then pay to have it done like it should have been done the first time. So they're actually
yes,
paying probably double or more than that to get it done the
yeah,
right way.
yes.
Okay, really good point that you bring up. Now, I'm also curious, Susie, when it comes to artistry, how important do you think artistry is and having that artistic eye in what you do?
It is the key. If you want to be good, you have to have that skill. And I don't think it's something you can learn. I think it's just innate.
Mm-hmm,
My dad was an artist, but I couldn't draw a stick figure if you paid me.
mm-hmm,
But I found my medium, and that's people's faces. I'm able to look at them and see what they need. It's all about balance, contour, and not overdoing people like you see some people out there. It's kind of scary. And I think that's why a lot of husbands in particular don't want their wives getting anything done is because they see the bad work out there.
mm-hmm.
And one of the things that we tend to do is help people look and feel rejuvenated without looking fake or unnatural.
That's a really good point you bring up because if it's done right, they're gonna look very natural. They're not gonna look overdone, but it's all in the
Correct.
application and then having that artistic eye, as you mentioned, to make sure it does look
Yes,
natural and balanced. Okay.
correct.
Now, Susie, I'm sure that you've had some challenging cases coming through your doors over the years. Is there maybe one story that comes to mind that you can think of just a memorable or a tough case, and how you were able to get them a great outcome in the end?
I think it comes down to expectations
Mm,
and painting a realistic expectation, letting them know the truth about okay, this is not going to be a facelift. You're going to get some tightening, but it's not going to be a facelift. I can't think of anybody in particular at this time, but as long as we're painting a realistic picture for the client, then most of the time it turns out nice.
Okay. And Susie, when it comes to the future of aesthetics, where do you think the future of aesthetics is going?
Regenerative for sure.
Hmm.
Yes. Um, yeah, I think that what I'm seeing is more and more people are wanting to do regenerative medicine um, versus, the very temporary things.
Hmm.
So they're moving toward longer lasting products.
Longer lasting, more natural, things like that.
Yes.
Okay. And when it comes to your practice, specifically timeless aesthetics, what's your vision for your practice?
Always to strive to be number one. And by that I mean um, that we are known for great customer service. We're known for great outcomes. And most of all, how people look and how people feel after they leave our facility.
Hmm. It's a great vision.
Yeah,
Okay. Well, Susie, I have one last question for you, but before I ask it, I do want to point people to your website at timelessaestheticsllc.com.
correct.
Now, last question is, what does beauty mean to you?
As I mentioned before, I think true beauty comes from within. People could look um, amazing and beautiful on the outside, but if they don't have a genuine heart, then they could be ugly. And so I think that's why we try to help people see their true beauty that they came in with, even though they don't see it yet. We're helping them look at that and want them to see how beautiful they are from the inside. And then the outside is you know, just makes it that much better.
Hmm. Well said. Well, there you have it. Susie sharing her expertise. So, Susie, where can people contact you and your practice?
Our phone number is 719-425-9336. You've mentioned our website. We are located in Colorado Springs, Colorado, on the north end of town. It's a beautiful facility, beautiful city, and hope you can come and check us out.
So, well, Susie, this is great. Thanks for coming on. Thank you for sharing your message.
Thanks for having me. I really appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.